Let's dive into a topic that might make you go, "Oh yeah, I've been there." We're talking about hemorrhoids, those annoying swollen veins that can cause discomfort where we'd rather not have it. Now, before we unpack the details of hemorrhoids, let me ask you, ever experienced an itchy or uncomfortable sensation down there? Wondering what hemorrhoids really are? Well, you're not alone. Join me in exploring the world of down there discomfort. What are your thoughts on hemorrhoids? Do you have questions, stories, or are you just curious about why we're discussing this? Stick around as we navigate through the world of hemorrhoids in the simplest, most relatable way. Let's have a chat, share experiences, and maybe even share a laugh about something more common than we might realize. Ready to kick off our exploration into the land of hemorrhoids? Let the adventure begin. Once upon a time, in a town not far away, lived Sue, a vibrant and health-conscious individual who diligently looked after her diet and exercised daily. After the arrival of her lovely daughter, Sue began to notice something concerning. Uncomfortable defecation, accompanied by fresh bleeding on some occasions, started to trouble her. Determined to address the issue, she decided it was time to seek help from her experienced general practitioner, GP. During her visit to the GP, Sue shared the details of her discomfort. Recognizing the importance of a thorough examination, the GP, considering Sue's family history of colon cancer, decided to take a cautious approach. He referred Sue to a specialist for a more in-depth investigation, a colonoscopy. Nervous but understanding the necessity, Sue followed through with the specialist's recommendation. The colonoscopy, though initially daunting, turned out to be a crucial step in unraveling the mystery of Sue's symptoms. After careful examination and colonoscopy, the specialist revealed the diagnosis: internal hemorrhoids. Relieved to have clarity on what was causing her discomfort, Sue engaged in a detailed discussion with the specialist. They talked about the potential reasons behind the development of internal hemorrhoids, with a particular emphasis on Sue's family history of colon cancer. The specialist outlined various available treatments to alleviate Sue's symptoms and ensure her continued well-being. "Doctor, what are hemorrhoids?" Hemorrhoids are swollen, enlarged veins that form inside and outside of your anus and rectum. They can be painful and uncomfortable and cause rectal bleeding. Hemorrhoids are also called piles. We're all born with hemorrhoids, but at baseline, they don't bother us. It's only when they become swollen and enlarged that they produce irritating symptoms. "Doctor, how common are hemorrhoids?" An estimated 1 in 20 has symptomatic hemorrhoids. They affect people of all ages, sexes, races, and ethnicities. They're more common as you age, affecting more than half of people over age 50. "Doctor, who might get hemorrhoids?" Anyone can get symptomatic hemorrhoids, even teenagers. You may be more at risk if you have overweight/obesity, are pregnant, eat a low-fiber diet, have chronic constipation or diarrhea, regularly lift heavy objects, spend a lot of time sitting on the toilet, strain while having bowel movements. "Doctor, what are the types of hemorrhoids?" Hemorrhoids can happen inside or outside of your rectum. The type depends on where the swollen vein develops. Types include: external, swollen veins form underneath the skin around your anus. Your anus is the canal where your poop comes out. External hemorrhoids can be itchy and painful. Occasionally, they bleed. Sometimes, they fill with blood that can clot. This isn't dangerous, but can result in pain and swelling. Internal, swollen veins form inside your rectum. Your rectum is the part of your digestive system that connects your colon, large intestine, to your anus. Internal hemorrhoids may bleed, but they usually aren't painful. Prolapsed, both internal and external hemorrhoids can prolapse, meaning they stretch and bulge outside of your anus. These hemorrhoids may bleed or cause pain. "Doctor, what's the difference between hemorrhoids and anal fissures?" Hemorrhoids and anal fissures cause similar symptoms, such as itching, pain, and bleeding. While swollen veins cause hemorrhoids, a tear in the lining of your anus causes an anal fissure. A healthcare provider will do a physical exam and may order tests to find what's causing your symptoms. "Doctor, what causes hemorrhoids?" Straining puts pressure on veins in your anus or rectum, causing hemorrhoids. You might think of them as varicose veins that affect your bottom. Any sort of straining that increases pressure on your belly or lower extremities can cause anal and rectal veins to become swollen and inflamed. Hemorrhoids may develop due to pelvic pressure from weight gain, especially during pregnancy. Pushing hard to have a bowel movement, poop, because of constipation. Straining to lift heavy objects or weightlifting. What are the symptoms of hemorrhoids? Internal hemorrhoids rarely cause pain, and typically can't be felt, unless they prolapse. Many people with internal hemorrhoids don't know they have them because they don't have symptoms. If you have symptoms of internal hemorrhoids, you might see blood on toilet paper, in your stool or in the toilet bowl. These are signs of rectal bleeding. Signs of external hemorrhoids include itchy anus, hard lumps near your anus that feel sore or tender, pain or ache in your anus, especially when you sit, rectal bleeding. Prolapsed hemorrhoids can be painful and uncomfortable. You may be able to feel them bulging outside of your anus and gently push them back inside. These are signs of rectal bleeding. Signs of external hemorrhoids include itchy anus, hard lumps near your anus that feel sore or tender. What other conditions cause hemorrhoid-type symptoms? Different gastrointestinal disorders can cause rectal bleeding and other symptoms similar to hemorrhoids. Bowel diseases that can cause bleeding include colon cancer, Crohn's disease, ulcerative colitis. Doctor, how are hemorrhoids diagnosed? A healthcare provider diagnoses hemorrhoids based on symptoms and a physical exam. You may also have digital rectal exam. Your provider inserts a gloved, lubricated finger into your rectum to feel for swollen veins. Anoscopy. Your provider uses an anoscope, lighted tube, to view the lining of your anus and rectum. Sigmoidoscopy. Your provider uses a sigmoidoscope, lighted tube with a camera, to view inside the lower, sigmoid, part of your colon and rectum. Procedure types include flexible sigmoidoscopy and rigid sigmoidoscopy, proctoscopy. These tests may be uncomfortable but aren't painful. They typically take place in a doctor's office or outpatient center without anesthesia. You go home the same day. Your provider may perform a colonoscopy to confirm findings from other tests or check for signs of colon cancer. This outpatient procedure requires anesthesia. Surgical treatments include hemorrhoidectomy. Surgery removes large external hemorrhoids or prolapsed internal ones. Hemorrhoid stapling. A stapling instrument removes an internal hemorrhoid, or it pulls a prolapsed internal hemorrhoid back inside of your anus and holds it there. Doctor, how can I prevent hemorrhoids? Hemorrhoids are common as you get older. These steps can help prevent hard stools and constipation that can lead to hemorrhoids. Don't sit too long or push too hard on the toilet. Go to the toilet when the urge hits. Don't delay bowel movements. Drink plenty of water throughout the day. Eat more high-fiber foods, fresh fruits, vegetables and whole grains, or take supplements. Generally, women should aim for 25 grams of fiber per day, while men should get 35 grams of fiber. Stay physically active. Being on the move keeps bowels moving. Take laxatives or use enemas only as recommended by your healthcare provider. Too many laxatives or enemas can make it hard for your body to regulate how you poop. Doctor, what is the prognosis, outlook, for people who have hemorrhoids? Most hemorrhoid symptoms improve within a week with at-home treatments. If hemorrhoids cause extreme pain and discomfort, a medical procedure or even surgery may help. Armed with a diagnosis, a treatment plan, and a newfound sense of relief, Sue left the specialist's office. Her journey to address the uncomfortable symptoms became a story of empowerment through knowledge and proactive healthcare. Sue continued to embrace her role as a mother, grateful for the guidance and support that led to a positive resolution of her health concerns. And so, Sue's story unfolded, a testament to the importance of seeking help and taking charge of one's health journey. In summary, learning about hemorrhoids is important for your overall health. We've covered what causes them, their symptoms, and the various ways to treat them, both at home and with medical help. If you found this information helpful and want to stay in the loop about more health-related topics, just hit that subscribe button. Subscribing ensures you'll get updates on new content and stay in touch with the latest insights. Remember, your health is vital, and staying informed is the first step to a healthier and happier life. So, subscribe now, and let's journey together towards a well-informed and healthier version of you.